Hi, Dr. Wallach. Can you hear me?
Yes, ma'am, very well.
Okay. So I'm just really ecstatic to be able to talk to you. I've been suffering for quite some time, and I first started out in September 18th. I had a really bad stomach ache. I don't know if I got food poisoning or what happened, but I was on the toilet with really bad diarrhea, thought I was going to die, wanted to go to the emergency room, but I kind of don't like those places. And ever since then, I have had a really bad stomach ache, and I've been to doctor after doctor, which I don't usually go to. And since the stomach pain, I have had just a plethora of issues.
Okay, well, stop there for a minute. What did the doctors say was your issue? Did they give you a diagnosis?
Well, they haven't really. I'm still on the list waiting to go see a gastrologist.
Okay, and so what other problems do you have? What other problems do you have?
They said gastritis, but, you know, I just don't know.
Okay, stop. I got to ask you a couple questions. Do you have any history of skin problems? Any eczema, dermatitis, psoriasis, or rosacea?
I have rosacea, and I also have a rash on my back that I've had almost my entire life. Okay,
well, let's just call it eczema, maybe. Close enough.
Okay.
And then, did you ever have any respiratory problems, any asthma, bronchitis as a kid?
Not really. As an adult, I've had a couple of attacks when it gets really, really hot outside. I feel like I can't breathe right.
Excuse me. Oh. Okay, Shar?
Yes.
What's Suzanne's problem?
She's definitely got a gluten intolerance.
Yep. And what do you weigh, Suzanne?
I weigh 170 pounds, and I am 48 years old, and I'm also an athlete. I play volleyball, and I am a volleyball coach. I play competitive volleyball. Since this situation...
How tall are you?
I have had, like, you know, a migraine here and there throughout my life, like maybe every 2 or 3 years.
How tall are you?
I'm 5'7".
Okay. All right.
Since this situation, I have had 6 migraines in 12 days. I've had a cold where my lymph nodes had swollen up in my neck. I've had extreme joint pain. Can't even turn my neck. Been to the emergency room 2 or 3 times. My viral load says that I have Epstein-Barr and a herpes 1, which I've never even heard of, and some other thing that I can't pronounce. It's called the cytomegalory virus.
Okay, Charmaine, Suzanne weighs 170 pounds. She's got her basic underlying gluten problem. She's got rosacea, and she's got this rash on her back, which I'll call eczema for lack of anything else. She has joint problems. She's got basic joint problems, pain in her joints, back, and so forth. She also has some virus problems, including herpes and those kind of things. So that means her immune system is down. So what diet would you put her on, and what supplement program would you put her on to support her body's ability to maintain and repair itself?
I would get her on a gluten-free diet, obviously, right away. No oils and no burnt animal fat. And then I would get her 2 healthy brain and heart packs, and I would also get her on the killer biotic and I think I'd get her on the colloidal silver, too.
Okay. And what would you do for the joint stuff?
She could take some glucogel for that, and, of course, some CM cream for the pain topically.
And what about sunshine?
Vitamin D3.
There you go. 2 bottles of vitamin D3 capsules. She could take 3 of those twice a day. She needs the glucogel, as Charmaine said. Suzanne, I'd get 2 of the large 240-count bottles of glucogel, so you can take 15 a day, 5 at breakfast, lunch, and dinner. They're designed to support and promote maintenance, repair, cartilage, ligaments, tendons, connective tissue, disc, cranial vertebrae, bone matrix, bone cell. And for the viruses stuff, if you have herpes on your lips or that sort of thing, you can actually put the colloidal silver directly on the open blisters or ulcers. If you have it on a cervix or something like that, where you have herpes viruses, or you have genital herpes, you can put the colloidal silver on a tampon, and while it's still in the applicator, apply it at night, leave it in there all night, take it out during the day, and do that every night for a couple of weeks. And it can, by actual contact, kill that herpes virus. Okay, give us a call every couple of weeks. We'll walk you through this. Sounds pretty straightforward, but your doctors have missed it. You actually should contact the State Medical Association and the state licensing things and tell them that your doctor has missed a diagnosis by 1,000,000 miles, and a naturopathic physician in 30 seconds, and his assistant, Charmaine, figured it out in just seconds.